This video is on, the question of, can the shoulder heal itself? And the answer to that is absolutely, absolutely. So, we see upwards of 5,000 patients, 6,000 patients actually a year that come in with pain in their shoulder. And of those patients, the vast majority actually get better with just doing physical therapy, time, injections, things like that. And so a lot of what we see is tendonitis in the shoulder or mild instability. Those types of things can definitely get better. And even if you have a tear in your shoulder, a common misconception, or I think people are worried that they're going to come in, they're going to see an orthopedic surgeon, and they're going to find some sort of imaging, and they're going to say, oh, you have this tear, and you have to have a surgery, or something horrible is going to happen, right? And the most common thing I see in my practice is rotator cuff tears, and we actually diagnose those in the office with ultrasound. So I think you come in, you get an X-ray, we evaluate your shoulder with an exam, and then we do an ultrasound, which takes like 1 minute, and it costs less than $100, right? So it's very quick, and then we'll be able to decide, do you have a tear or not? And depending on a lot of factors, will help us make a decision as to, is your shoulder going to get better with therapy or not? Fortunately, at least 50% of patients who have rotator cuff tears get better with physical therapy, right? And so does the shoulder heal itself? Well, the tears don't heal, right? Like once something is torn in your shoulder, it's torn, it's done, right? But the problem is not the tear. The problem is the mechanical disruption of the system, right? Like the mechanics of the joint have been disrupted because something is torn, right? And something's not functioning correctly. So with the rotator cuff, if part of the rotator cuff is torn, let's say you have a tear in one tendon, the supraspinatus, if you strengthen the other three muscles around the shoulder, right, you could actually compensate or cope for the part that's torn. So that's why 50% of patients that come in with rotator cuff tears get better with physical therapy. And what we do is we ask you what's called a SANE score. We ask you what percent of your shoulder is normal, right? And what we have found is that if you're below 80, right, if you say my shoulder is less than 80% normal, then you're in the operative realm, right? You're someone who says like, this problem is big enough to where like, I'm gonna have an operation to fix this problem because this is really affecting my life. Once you get to 80 or higher, what we have found is those patients are actually perfectly fine with leaving their shoulder alone. And there are very few problems that I see in the shoulder where if the patient has good function and minimal pain, that I would say you should have a surgery. Like why would you do that? We operate on patients that have pathology, right? But also have pain and dysfunction, right? So the goal is to not heal the tear. The goal is to remove your pain and get your function back, right? And there are actually probably 1 billion people walking around with rotator cuff tears that don't have any pain because they have a shoulder that's compensated and coped. And you try to wrap your mind around why this happens. I think a lot of it is, the body does have the ability to adapt to pathology, right? And in some patients, their body can slowly adapt over time. Like let's say a rotator cuff tear occurs across 1 year versus 30 years. Well, if you have 30 years to slowly adapt your body, then you have a better chance of having a compensated or a functioning shoulder with a rotator cuff tear. Whereas if it happens at a quick pace, faster than your body can adapt, then you'll have a lot of pain and dysfunction. You'll end up getting surgery to get it fixed. And so again, coming back to the original question, can the shoulder heal itself? Yes and no. I mean, I think if something's torn, it's not going to heal, but can you fix your problem with non-operative measures? 100% yes. Like we do that all the time. So I think the key is getting in, getting seen, and really it's to, you go in, you try the physical therapy, and we've got a reasonably good chance at fixing it with physical therapy. And a lot of times, sometimes no, sometimes I'll say, listen, this is not a problem that does well with physical therapy. Some do, some don't, and they're all different. And there are subtle nuances that it's important, I think, for you to see someone who specializes in this to tell you the truth about, what your odds are of success so you don't waste your time. And in some patients, it's just, you don't know until you try. I mean, you go do the therapy, and if you get better, great. If not, then for the majority of surgeries we do in the shoulder, we have a 95% success rate in terms of fixing the problem, making you significantly better. So I think there are very few problems that people come in to see us with that we can't fix, right? Either we fix them with therapy, we fix them with surgery. And some patients, they do therapy, they still hurt, and they don't want to have surgery. And I said, fine, you don't need surgery. If you don't want surgery, you don't have surgery. So I think, can your shoulder heal itself? I think the first thing is to always get a correct diagnosis and see someone who does a lot of shoulders. The second part is talk about what the options are and what the odds of success are with all the various treatments. But fortunately, for most of our patients, right, I mean, like at least 60, 70%, there's fairly good odds that you're going to be able to fix your problem without having to have an operation. Some patients, a lot of patients see us because they need to have surgery, or surgery is going to be the only mechanism to fix their problem, and that's okay. But I think a lot of people fear seeing a surgeon because they're worried they're going to tell them they have to have surgery. We don't tell anybody they have to have surgery, so fear not. We're not going to say that. We're going to say what your problem is and what our experience and what the literature has shown to be the odds of success with the various forms of treatment for your specific problem. And it may be surgery, it may be therapy, but you don't know until you know what the problem is.